Hi, I'm going to discuss the defibrillator again because I think that the presentation I gave a couple of weeks ago needs to be revamped. And with this condition, it's important. We all need to know about it, and we all need to know how the defibrillator functions, the working principle behind it. So with ventricular fibrillation, it's a critical condition. It's one of the conditions that requires cardiopulmonary resuscitation. And what happens is that there is erratic electrical activity of the heart. There's no cardiac output whatsoever, and macroscopically the heart looks like a bag of quivering worms. And what's needed is electrical current to stop that erratic electrical activity and facilitate the sinoatrial node to take over and govern the heart rate and restore sinus rhythm. And once that occurs, cardiac output is re-established and the patient survives, right? So now the thing is, how does this happen? We need to store charge in order to discharge current at the appropriate speed to convert that erratic electrical activity. Now, this charge can only be stored in a capacitor. It can't be stored in a battery because a battery will release it very slowly and it won't be effective. With the capacitor, it will release the charge quickly and it will enable the current of the right speed to convert that erratic electrical activity. So you cannot just simply connect your electrical supply to the patient and provide that current. That electrical supply needs to hold charge, and that charge has to be of a specific value and released to cause that current. So in order to store charge, you need a device known as a capacitor. A capacitor is a device that stores charge, and essentially it's two conducting plates separated by an insulator. Now this device can only be charged with a direct current, okay? So when you're looking at this capacitor or the defibrillator, there's two components to it. One is charging it and the other one is discharging it. Now the thing is, when you charge it, you have to acquire a certain voltage to charge it, and the voltage is about 5,000 volts. So in order to acquire that voltage, you need alternating current. And our mains power supply is alternating current. So what happens is that when the electrical activity occurs, the transformer within the defibrillator steps up the voltage to 5,000 volts. Once it does that, it then has to change to direct current, and that direct current charges the defibrillator. And once it's charged, it's then discharged. And when it's discharged, there's two parts to it. One is the release, and two is the transfer of current. Now, the release can be very quickly, and it can cause burns. And that's why there's a device known as an inductor that will slow down the release of the current because it follows an exponential curve. And the inductor makes sure that the release of the current is commensurate for causing defibrillation. It's not too quick, not too fast, because if it's too fast, it can cause burns. So that's the purpose of the inductor. The second thing is the impedance. The impedance is also known as resistance. And now the thing is, patients differ according to the amount of adipose tissue and air in the lungs. Some people have emphysema, and that affects impedance. The impedance is higher in patients that are obese. So what's needed is multiple shocks to overcome the impedance. But now we have something known as a biphasic defibrillator, where the shock goes in one direction and then in the opposite direction. So when it goes in one direction, it overcomes the impedance, and when it goes in the opposite direction, it defibrillates the heart. Then you have something known as a smart defibrillator. Now with the smart defibrillator, a signal is passed through the patient, and the impedance is assessed, and the microprocessor within the defibrillator then selects the current that's needed to overcome that impedance. So that's discharging the defibrillator. Now the question comes, what happens with a battery operated device? Now, battery operated devices use direct current, but the thing is, direct current cannot be stepped up in voltage. You need to step up that voltage so that the transformer can increase it to 5,000 volts. So what happens is that direct current is converted by an inverter to alternating current, which is then used to step up the voltage to 5,000 volts, and thereafter it gets rectified to direct current to charge the capacitor. So that's how battery operated device works. So back to the principles. One is charging and the other one is discharging. With charging, you need to step up the voltage using alternating current, charge the capacitor using direct current. And with discharging, you need to slow down the current released through an inductor, and two is you need to take care of the impedance. So that's basically the principles behind the defibrillator, and the application of the pads and the other protocols as per ACLS will be discussed in a later stage. Thanks a lot for listening. Okay.